everyone, and welcome to today's live stream. Sorry I was running a few minutes late. We had a train at the crossing here in Tuscola that slowed me down a little bit. I'm Dr. Sally Foote. I'm a veterinarian and an animal behaviorist. I also provide online as well as live now, back with the pandemic starting to ease up a bit, veterinary and client education about less stressful veterinary care, behavior. And also now I'm adding in events on using telecommunication, telehealth, and telemed in veterinary medicine. Coming up on Sunday, May 16th, I will be hosting an in-person workshop, and we are also going to live stream it with Dr. Shauna Gardner. Dr. Shauna Gardner is an expert in veterinary telehealth. She's also a general practitioner in Marshall, Illinois, not too far from here. She's a friend of mine. And she has been providing teletriage services through a company and is very highly knowledgeable about not only the legalities of providing telehealth, telemed, consults in veterinary medicine, but also actually doing this. And I myself use telehealth consults as the means of how I provide veterinary consults, veterinary behavior consults, and I've been doing this for the last 5 or 6 years. So today's Facebook Live is really about how we can provide, like how and why we should be really gearing up in our practices for telehealth, telemed consults to our clients. Okay, so, this whole idea of, let's use video chat, let's use texting and automate, communication with our clients and setting up appointments and online pharmacy, etc. That's really been promoted pretty heavily for this past year, but we have, frankly, really low engagement with our practices. Now, I think the reason why, and I can totally understand it, if I was back in the trenches at my general practice, I probably would have been like, hey, I can do it for behavior, but I don't know about anything else. Because our veterinary practices have really been inundated with a high volume of, exams and checkups, etc., through the stay-at-home orders. Clients are home with their pets and they're really paying attention to them. And so now they're coming in for maybe some of the, orthopedic exams and recheck on bumps and lumps and skin problems, etc., that we've always said, hey, you ought to come back in on. And so now they are. We also had to empty out the shelters. So a lot of people, picked up pets or got pets or, acquired a second or third pet that may not have had pets before. And so they're seeking, going into the veterinarian for their general care or first exams, etc. Well, this intense load on the practice now has created a very high call volume, as well as, a lot of exams and things. And it's hard. It is hard when you are busy, but you have 25 appointments in the day scheduled per veterinarian, or maybe there's 40 transactions or 50 transactions per provider coming through that practice. So it's like you're almost, you're swimming in the pool, and now we're saying, use this new, technique, use this new tool, here you go, but I've got to use it now. And I don't know, I haven't practiced using it. And I don't know, how to get my clients to want to use this. What do I say? What are the scripts? Well, wait a minute. We've got this VCPR, the veterinary client-patient relationship, and everybody's talking about that. And can I do this? Is it legal? Is it not legal? Okay, so in today's presentation, I want to just quickly outline not so much, all of those things. That's what we're covering on this workshop, where we're going to get our hands dirty. We're going to sit there with some of these platforms and actually some friends who are going to be your guinea pig clients, where you can actually try it out on them, and so that you're ready to go the next day and start to utilize what you have. But right now I want to talk about where things are at with telemed, telehealth for pets right now. First of all, okay, I'm going to say the evil empire, Chewy. Okay, how many of you knew last June Chewy began offering telehealth? Telehealth is where you give advice, you make triage, you are not prognosing, you are not prescribing, and you are not diagnosing. No VCPR needs to exist. But through Chewy.com's auto ship service, they are providing to their auto ship members the ability to chat, so this is text, to a veterinarian hired by Chewy to answer questions about their pet. Hi, Chewy, my dog just threw up once. What does it look like? Clear saliva. Now, the veterinarian is not going to say what that is. They're not going to advise a medication. They may give general advice. Dogs may throw up when they eat grass, or they get into something that may cause irritation to the stomach. Is your pet able to get up and walk around? Is your pet da-da? They may ask a few questions. These are triage questions. This is no different than what you do on the telephone. You don't need a VCPR to ask these questions and to triage how urgent this is, and to advise what may have caused the problem, and to even advise a bland diet or get to the vet immediately. Okay, your pet is having difficulty walking and threw up 4 times in the last 2 hours. Go to the local veterinarian, go to the emergency clinic. That amount of, contact and advice is it's very valuable to a client. Right now, if there's, they should just call my office. They can't get in to call your office. Your line is constantly busy. Or secondly, they're calling to see about getting their pet in for an appointment. Well, we can't schedule you in for another 3 or 4 weeks. So if they can't get you and they are auto shipping on Chewy and they know they can go to Chewy, who are they going to go to? They're going to go to Chewy, right? Not just because it's free, because it's not really free. They have to pay their auto ship fee, to have that feature, fine. But somebody's available for them. If they had a way of knowing they could text you, or when when you get an email or text saying, Fluffy has vomited once or twice, what should I do? And then your tech can say, okay, let's flip this over to a video consult with Dr. X or even the technician, because under the veterinarian supervision, this is going to fall within the realm. Let's do a teletriage video chat, because I like to see your pet. And then you can use, whether you're using Zoom or even what I'm doing right now on the phone through a FaceTime or Facebook Messenger, whatever. And that's what I'm going to cover in this. But anyway, your clinic says, it'll be $20 for us to do a 10-minute video consult, so we can say exactly what, give you a better advice on what to do. Most clients are going to say yes, because they're going to get your help. You are also going to have a recording. You're going to know what you said, okay? You can record those video chats and put that file in with the electronic record. And lastly, how urgent is it? Whoa, we got to get you in today. Now the staff understands this better, way less back and forth with phone calls and grab the doctor emails. And secondly, you can give more clear advice what to do to help that patient either get through the night or get through the day until they can see you. And the client knows, I go to my vet clinic and here's a way I can get to them. I don't have to just, I'm not struggling with, I've got to make the appointment. I'm getting some level of help from the trusted person I want to get that advice from. And lastly, you can create a revenue stream. And clients are willing to pay for this. I think that's the other thing, is we are not accustomed to finding ways to charge for our time. And we might spend a half an hour on the phone, where I've seen it, especially with my behavior consults. I flip it to a quick video call, like maybe on an iPhone. I say, you're on an iPhone, okay, boom, we're gonna do a FaceTime right now. In literally 30 seconds, okay, I see how your dog is stumbling across the slick linoleum floor with his neuropathy. Let's get a yoga mat or 2 down. Okay, you don't have one, go to Walmart and buy one, they're cheap, there. Or a runner, so he's not sliding out and aggravating the tibial plateau surgery he had a month ago. That's advice. That's not a diagnosis. And that advice is priceless to our clients, and you would not have known that if you didn't see that on the video chat. But guess what? Chewy will. They may be doing chat now, but they may also offer video calls. There are other programs out there that offer the chat and or video feature for a subscription service. In other words, your client may be paying $20 or $30 a month to something like Whisker Docs. And Whisker Docs is providing these telehealth consults, teletriage consults by chat or video call to your clients. And you don't know what's being said. Now, everything may be fine and very legal, but if you don't have a contract with Whisker Docs to provide this for your practice as a way of outsourcing it, You won't know what Whisker Docs has told your client. You won't know that your client may have gone there because it may have been as simple as, oh, let's put some yoga mats to prevent him from sliding out. Client does that, dog's walking better. The dog is not as sore on his back leg. They skip the recheck with you for rechecking on that sore leg because it's not sore anymore, and you don't know what went on. If you now, on these kinds of questions, say, let's do a video consult, 15 minutes, gonna cost whatever. You decided to cost, and you saw this for the client, it would now be in your medical record. The client would think you are awesome, which you are, for providing this advice. And you may even emphasize still like, okay, even if your pet is still going better, I'd still like to recheck him in 2 weeks to be sure, after going through this of sliding on the floor, that that knee is still healing well. And if the knee is still healing well, you say, great, let's keep the runners in place, right? You would still support it. But it keeps you connected in a way that does not require a lot of other staff, does not require a lot of other equipment, because these chats are done on your phone, in your client's phone. They're done on a tablet. You could do it on your laptop if you wish. But my main point is this, that we lost internet pharmacy, the ability to really have the kind of the limitations of use and best use of it, etc. When internet pharmacies were first introduced. 1-800-PET-MEDS was seen as the evil empire and doing everything wrong, you know, with online prescriptions for pets. And while some of those things were done incorrectly, but what it was doing, it was filling the consumer's desire and the consumer's need. And so now many practices have online pharmacies. Why? Because that's what clients want and that's what they're going for. But we were way behind the path on that. And we lost a lot of good opportunity for managing our pharmacies better, for engaging with our clients better, for building trust with our clients better through a home delivery online way. And telehealth is another service that our clients are getting this. They are seeking this. The amount of growth, 28% is the estimated growth of all teletriage, telehealth, telechat services in general to the pet population. And that is why Chewy has gotten into this and these other kinds of online providers that are outside of your practice. So bringing it inside of your practice is important for, first of all, serving the client, but secondly, to really decrease your stress. Okay, now it's a bit stressful to think of, how am I going to do this? How am I going to get it started? And so that's where, having it, I think the best thing is something like this workshop that we're going to do, where you can not only sit and hear me and Dr. Garner say, here's exactly how, when you don't need a VCPR, the words you can say and how to do it. When you do have the VCPR, how you can say and do even more and do it. Here are the scripts for your front office staff for the decision tree. What are the kinds of exams that would be good to do on a video or chat versus not? And then platforms for payment, or how to get the online payment. And then lastly, what kind of communication platform should I use? Should I use one of these platforms? And we're going to have one to literally try out that day. And then kind of, if you want to call it the homemade version, the home cooked version of things like FaceTime just on the phone to phone or phone to iPad, or Zoom or GoToMeeting as kind of an already present, online meeting type app, and then taking a payment through something like Square or whatever. I mean, now how it reduces the stress in the office is a couple ways. A lot of clinics are really getting burned out by this heavy phone call load. Clients are very irritated by the long wait still. You guys are hearing it from the client's reaction. I am hearing it, and I'm not blaming you. I understand the longer it takes for curbside, and clients may drop off the pet and drive off. Okay, it's like dry cleaning. Drop off, come back and pick them up, and you're like, wait, I want to call you on the phone. But we didn't get an established way of utilizing, really saying, when you're sitting here, let's do this way in the video chat. And so then it may actually delay care, etc. So how does the telehealth help to decrease the staff stress? Well, okay, First of all, utilizing, say, a chat feature, so we're decreasing the phone calls coming into the office. Secondly, you can have one of your vets or one of your techs being the person at home, like a remote worker at home, that is answering a lot of the messages that are coming in through your practice information management system and answering those messages, doing the reminders. They don't need to sit in the practice where the phone is constantly ringing and they're exposed to the staff's stress of long days, long hours, euthanasia, etc. I think it's environmental stress for us in the work environment. So telehealth, telecommunication can help us be less stressed while we're still providing work, providing services and being productive for the practice. The second thing is so many practices now are saying, oh my gosh, I need another veterinarian. Oh my gosh, I need another technician, and you do. But to try to find that veterinarian or technician in your area who can work these hours is really getting tough. So finding and seeing how many of our rechecks, recheck examinations, gait examinations, even recheck on dermatology examination and other internal medicine, rechecks and maintenance for health, post-surgical exams can all be done on video chat. And that could be done by a veterinarian at home, even someone like myself in Tuscola, Illinois, as an employee or a service provider to a practice in Chicago. I don't have to travel to Chicago to provide this work for this practice. I can do it from my home in Tuscola, and then you're going to get paid, and then you pay me. So it's a way of extending these professionals without them necessarily having to go into work. Secondly, could be a way, if a veterinarian or a technician is thinking about working for your practice, they may be able to work in this way for you periodically, or maybe for a specialized service like behavior or welfare or pain analysis, pain evaluation, end of life, quality of life exams, and kind of get a taste for your practice. Do they really come to want to work at your practice? And you get a taste for them without a big commitment and a big move. Okay, that could be a way of doing it. And then, as I said too, the remote administrative worker can work from home to get away from the stress of your work environment or balance their life and childcare needs. Maybe they do 4 hours as an administrative worker from their home, plugged into your PIM system, maybe providing a few chat type services or even a video service as a triage to the doctor back at the home-based office. And then the other rest of the day they have that they can be with their family as they need to be, etc. So bottom line is this: veterinary medicines need to step on the gas on this one. We have to be in there offering and finding the ways that that works for your practice. I'm not saying everybody has to do it the same, no. But find a way to offer this, monetize it, and practice it so you can use it right away. That, I think, is the hardest thing, is that if we haven't got our hands on it and actually done it a few times with a few guinea pig friends, we're always going to hold back. And in the meanwhile, we're going to have our Chewies. Walmart will be in this. They're already getting vet practices set up at Walmart. So believe you me, they're going to be up on this too, I'm quite sure. The Popup vaccine clinics, Dr. Garner was telling me about one of the main corporations with the Popup vaccine clinics, is already linking those clients right into video recheck, telehealth, reconnection, etc., like maintaining that client relationship all through automation of telehealth in these pop-up vaccine clinics. So we need to have these practices find a way that they're directly offering it, so the client is going to stay within your practice, and it's going to be providing better medicine, because now you're going to know what this client was told, what they were advised, and the progression, like how is this animal doing, and lastly, what is the home life like? I really strongly feel that every animal should have both an in-person physical exam every year and a telemedicine, telehealth video call checkup, because what's going on in that home, what that home looks like, what the arrangement of the furniture is, there might be 3 or 4 other animals in that home that you never knew about. They're jumping on them or causing stress, or 2 or 3 children, grandchildren coming home for babysitting. There's bite risks that you had no clue about. Now you know what's going on, and you can give quick advice for best life with that. And that is so, so valuable, not only to you, but also to your client. They really, really value that. Well, thank you, everybody. I hope you can make it to the May 16th event. Now, I just put the event on my event calendar on my website, drsallyjfoote.com, so please go there, and you'll see the event calendar on top. I will also create the event page. I will be sending out my newsletter here this afternoon from myself, and I will have the registration link and the event page for you to go ahead and register for this workshop that day as well. We'll probably repeat the workshop a couple times this year, but I really look forward to attendees engaging with that. We will be able to have 20 people on site here in Tuscola, following the state of Illinois limitations for gathering and square footage in my Bella Learning Center here. So 20 can be in Tuscola, and it's unlimited for who can be on live stream. In Tuscola, I think is going to be the most enriching for you. You know, really get your hands dirty on computers and tablets and phones and seeing it, and having myself and Dr. Garner right here in person to coach you through it and answer any questions. But, you know, I'm offering live stream also just as another way for you to get a chance to really like see and hear from people who've been using this ourselves, Dr. Garner and myself, for years, and can help you step it up to really utilizing this. Thank you, everyone, and have a great day.